Our next modality is called moving cupping. Sometimes it's called sliding cupping or running cupping. And within sliding cupping, there are two different types of sliding cupping. There's light sliding cupping and then strong sliding cupping. I'll begin with a demonstration of the light sliding cupping. And this is really similar to what we saw in terms of the light or the weak static cupping. You're using a light to a medium amount of suction, and you're using just like a medium-sized cotton ball, and it's just sort of a medium amount of time between the introduction of the flame and the application onto the skin. So with this, you're going to place the cups onto the skin and then you're going to move them around. So here I'll show you with 2 cups. So just a medium amount of suction here. This would be what I would consider sort of somewhere in between light and medium suction when we were doing static methods. So now that you have the cups placed onto the skin, you're going to slide them or you're going to move them as the name implies. And you're not just going to go ahead and move because that can be really uncomfortable for your client. So you'll use your opposite hand to support the cup as you go through. So it's a nice way to sort of help the cup glide by like pushing the skin kind of down and around and out of the way. So you'll place your hand and allow that to move around. And so sometimes the cup won't move right away. You'll try to move it, kind of jiggle it a little bit. If it still doesn't move, that means there's too much suction here. So you just let out a little bit of that suction. And then now you're able to move the cup because this is a light technique. So we're not going for a really strong reaction here in terms of the marks. We just want a slight reddening of the skin, and then the marks will fade in a few days. This is an even method. It's not tonifying and it's not draining. It manipulates the lymphatic system, so the fluid system, as well as the chi system, but it does so without exhausting your client. And the range of application here with your clients is you can do this on people who are elderly or frail, people who are prone, who are recovering from illness, people who just want like a stress release, conditions where swelling or edema is present, including in the joints, abdominal discomfort, or immune deficiency, and then children under the age of 16. If your cup happens to just pop off while you're working, and that happens all the time, so let's say the cup just lifts off, that's okay, that's no big deal. You would just kind of set things up and reapply the cup and continue moving the cup through. So again, we're at a medium flame, a medium distance from the skin. And most people really like this technique. It tends to feel like a massage, but it's, a wide range of clients can handle this type of pressure. And you just want to be really careful to avoid any bony protuberances. So for example, here, the inferior angle of the scapula, if I wanted to get this cup over to the lateral portion of the shoulder, I wouldn't just go over this bony protuberance. You would just go up and then over. Kind of stay on the big fleshy parts of the body with this. So don't move over something that would be an area where the cup could catch. And if there's any moles or blemishes, just move the cup around and out of the way. And you can see here with my model, the suction is so that I'm not really leaving very much of any sort of mark on his skin. And that's very normal here because I'm not using a strong technique. The suction is at just a really weak to medium suction. And you're not really moving the cup around in a really vigorous manner. Moving cupping is always more comfortable and it feels better for your client to go in long strokes. So rather than just kind of go up and down in one area or like in a circle, that tends to not feel very good for clients. So you can go in long, sliding, sweeping strokes. And then whenever you feel like there is a slight reddening of the skin, and we're getting a little bit of that slight reddening up here in the upper reaches of my model's back, then you would feel like it's time to stop the treatment, and then you would just remove the cups. The next type of moving cupping is strong moving cupping. So this is like weak moving cupping, except there's going to be a much greater suction inside the cup. And sometimes it can be tempting to use a larger cup for this. So for example, this is what I would consider a large size cup. And you don't necessarily want to use a large cup when it comes to moving cupping, strong moving cupping, regardless of the size of your client, because these can be really difficult to move and they can be very uncomfortable regardless of the client size. So I recommend that you stick with a small to a medium-sized cup, even though you're doing a strong technique here. So with this technique, because you're going to be introducing a stronger suction, then I have 2 cotton balls here. And I'm going to reduce the amount of time in between introducing the flame to placing this on the skin. So this is pretty close to the skin, fire goes in, and then this goes right on the skin, and we see a great deal of the skin is drawn into the cup here. With the strong cupping, because so much skin is drawn into the cup, sometimes with certain clients, you may not be able to get more than 1 cup onto the region, and that's totally fine. So for example, if this had pulled so much of my model's skin into this cup and I couldn't get this one on, then that's no problem. You would just use 1 cup. So that's what I'll demonstrate here. So this is quite a bit of suction here, and what you want to be able to do is have the cup move all of the time on the skin. You don't really want to leave this cup in one place. And this might be really difficult to move. This, I would say, is probably going to be the most uncomfortable type of cupping for clients. So if someone's not really used to cupping and they've never had it before, this may not be something that you want to do on their very first time, on their very first exposure to cupping. And always use your opposite hand to really help support. And if you come into a region where it really just feels sticky, then you can let some of the suction out of the cup, but what I recommend is just try to support also with your opposite hand, because we're doing a strong technique here, and really get that cup to glide through. So we're starting to see the marks here are dark red, and we're starting to see some shaw appear along the course of the treatment. And because this is so strong, the shaw or the marks can be present for up to 2 weeks. This is a very draining technique. It powerfully resolves blood stagnation. It removes excess pathogens from the body. It really brings this heat to the surface of the body so that all of that can be released from the skin. Your client must have very strong and robust Wei Qi in order for them to feel the benefit of the treatment. Otherwise, it can exhaust their Qi. This is the most strong form of cupping, along with the strong static form of cupping. The range of application here are chronic musculoskeletal injuries, sports injuries, back pain, sciatica. So if someone has a sciatica injury, you would do this over the SI region in the low back. Excessive heat conditions. Sometimes you can use this for feverish or febrile conditions as well, if someone has already been cleared to have cupping in those conditions, and only use this in children over the age of 16. You're never leaving the cup in one place. You're always moving the cup around. And when you start to see this dark red shaw really appear along the course of where the cup is, then you know that the treatment is complete, and you can go ahead and remove the cup. And this, because this is such a strong form of cupping, always check in with your client and make sure that your client feels like this is enough pressure or not too much pressure, that it's appropriate for their comfort level.
If you liked this video and you want to see more, make sure to subscribe below and don't forget to hit the notification button.